Dry needling is one of those topics that some people have heard a little bit about and some people have not heard that much about. So the biggest thing that you want to know about dry needling is it uses the same type of needle as an acupuncture needle. So it's called a dry needle, and that there's no gauge to the needle. It's not used for injection purposes to deliver medication. It's a monofilament needle. Now, there's different indications for use of that needle, which is what we do in the clinic with trigger point dry needling and dry needling with e-stim. So trigger point dry needling is where we take that acupuncture needle, that monofilament needle, and we insert it into the skin and then go down into the muscle where the trigger point is located. Well, trigger point essentially is a taut, palpable band in a muscle that typically will refer pain somewhere else or be locally tender. So we use that needle to get that trigger point to do what we call a twitch response. And so that's when the muscle actually contracts, but it's in a small section of the muscle. So it's not like the whole entire muscle itself is contracting. Why this is important is because we've got muscle fibers, which should be like so. So they should overlap and have room to contract and then relax. And when you have a knot or that trigger point in the muscle, it's stuck like this all the time, which is why you can feel that knot when you palpate it, when you're feeling it. You can roll over something that's tight. You're like, ugh, and that hurts when I touch it. So this muscle is in what we call an energy depleted state because it takes energy for a muscle to contract and it takes energy for that muscle to release and go back to its resting length. So what we do by inserting the trigger point needle, that dry needle, is when the muscle is like this and we produce that twitch response and that muscle twitches, and we get a couple of twitches out of that muscle, okay, and keeps twitching, then we can actually start to learn how to elongate and get out of that holding pattern. So that's the purpose of why we want to produce the twitch response, which is specific to trigger point dry needling. Now, we can also use the needle for other purposes. We can use it to help with fascial reorganization, which is helpful with scars and some myofascially taut bands. Then we can also use the needle and insert an additional treatment, e-stim, and we associate e-stim, which is electrical stimulation. So we put that with the needle, and then that produces a different kind of response, for more of a pulsating response to the muscle. And so we can use that for different purposes. Maybe it's more for like muscle reeducation. We can use it for helping the muscle to relax. We can use it for being able to treat things like bursitis, where there's a lot of edema. And so that pumping of the muscle can help to pump some of that edema that's been stuck around the area. So maybe you've got a hip bursitis or something like that, that pulsating response can be helpful. But then also, like I said, like that re-education. So maybe we have some muscles that aren't talking as well as they should with our brain. Maybe there's, I don't know, you've got a disc-related injury and you've got some associated weakness, things like that. All sorts of different things can happen for why when our brain tells our muscle to do something, we're not getting the output that we want. Many different reasons for that. So essentially, that's dry needling in a nutshell, and hopefully you found this helpful.